Okay, we'll give everybody a few moments to jump on. Happy Valentine's Day, everybody. Happy Valentine's Day, right, Sarah?
Yes, happy Valentine's Day.
We you are gonna love this one today. We have Sarah, and Sarah, I'm so glad you picked Valentine's Day because this is a great way to kind of give yourself, I'm gonna call it self-care or lots of love. And we have, if you're joining us, say hello. Hi, Victoria. We have people already jumping on. We are going to be talking about the lymphatic system and how it relates to weight loss. And just as a little introduction here, you guys, Sarah is incredible. Like I've never met somebody with such an extensive background of knowledge. She is an occupational therapist, a lymphedema therapist, a personal trainer, a health coach, a massage therapist, a certified nutritionist, yoga enthusiast. She has over 200 hours of training with that, and she takes all of this and integrates it. And today's topic, we're going to be really diving into the lymphatic system and how it can affect weight loss because it can play, I feel like, a really crucial role in giving your body that balance in so many ways. And Sarah, I'm going to just kind of allow you to do more of a formal introduction because there's no way I can give you justice for everything you're here to say and do. So I'm going to mute myself for just a moment. I'm going to jump onto Facebook.
Okay. I couldn't hear the last part of what you said, but so just a little bit about me. I've kind of struggled with weight my whole entire life. And, so often we get all this information, you start researching things online and it's, you're trying to help figure out what you need to do to be healthy. And there's all this conflicting information of what diets to follow and what exercise plans to follow. So I started out after I graduated high school. I started out as a massage therapist, and I learned about the lymphatic system during that training, and I was instantly intrigued by it. But as life would have it, I ended up in the field of occupational therapy, which has been just a huge blessing for me. I've helped so many. I've been able to meet so many wonderful people and just kind of help people function wise. And I've worked in basically every type of OT setting you can work in and across the country. And, all during this time, I was gaining weight, losing weight, that back and forth struggle. So, I ended up falling in love with yoga during one of my times of weight loss, and did the 200-hour yoga certification, kind of to help heal me, but then also to help share that practice with other people. And so I during COVID, like most of us, we kind of put on that weight. I was pregnant, packed on extra pounds, and I just had gotten to that point where I was like, enough is enough, and I need to make some major lifestyle changes for myself. So I went through bariatric surgery. I had the gastric sleeve done in 2021, and then shortly after that, I ended up getting my lymphedema certification. And just, I've been able to, like, as I was going through my weight loss journey and getting ready for bariatric surgery, I just saw all these huge disconnects of what our medical model is offering. And, I was kind of heartbroken. I think we kind of talked about this is during, like as one of my insurance requirements, I had to show that I had issues with morbid obesity for over 5 years. And mind you, during that time of my life, I was in Ohio, I was in Texas, I was in Oregon, I was in Arizona, I was literally everywhere. So I had 5 different doctors, and every single note said that patient was concerned with her weight, but never was I referred to a dietitian, never was I referred to a nutritionist, anything. It was just like, just diet and exercise. And there's so much more than just diet and exercise that goes into it. And then, I did my psychiatric evaluation, and it was just kind of like, I felt like a checkbox, like nothing addressed any of the components of what I needed to do to make that lifestyle change post bariatric surgery. So it kind of motivated me to start my own practice as an occupational therapist, lymphedema therapist, just to really create a holistic practice to help people along their bariatric journey.
Sarah, I love that. So it's interesting to me that you ended up getting that after you had weight loss surgery. Were you having any struggles with lymphedema?
So, and I'll kind of talk about this in a little bit. Anybody that has a BMI over 30 has a compromised lymphatic system. It doesn't mean that they have lymphedema, but their system can't work as properly as it should. So, I definitely had a BMI over 30. So, I do have some issues with that residual swelling, and then in addition to some lymphedema characteristics as well. So it's been kind of one of those things. I did it to help heal me. But then I'm also able to help other people to understand what's going on and help implement some of the tools that I've gained in my tool belt.
I love that. Thank you for sharing all that. And it's true. It's like what I think that that's probably like our biggest gifts in our life are the things that we learn ourselves and are able to share and help others on their journey too in some way, because we're all on this together for sure.
And it's definitely a journey that should not be taken alone. Like you need that support system and just, that encouragement and motivation to keep going because it's definitely worth it.
That's again a great thing for Valentine's Day to kind of share and to be a part of that. So well, I say we jump into our topic because I know you have a lot to share and a lot of good things. So Sarah is going to be I'm going to let her kind of jump in and say what she's going to be talking about for sure because there's several things. Um, I'm muting myself here in a second. My dog is back. He's coughing. Anyways, yeah, I'm gonna just let you jump in and talk a little bit more about what you're going to be talking about and jump right into your topic.
Okay, so I'm going to go ahead and share my screen here. Hopefully it's not too, I can get kind of, I think that the lymphatic system is super interesting. So I kind of wanted to give some background on what it is, and then how it does affect our weight. Basically, our lymphatic system is comprised of vessels, lymph nodes, organs. And the purpose of the lymphatic system is to help get rid of the fluid, the waste products, and then it helps remove pathogens that are in our tissues. A big part of the lymphatic system is that it helps to maintain the fluid balance in the body, which helps prevent that swelling or that edema. And then it transports nutrients. And then in the intestines, it helps absorb fats and fat soluble vitamins. And then it filters the pathogens such as bacteria and viruses to help keep us healthy. And then it works in coordination with the circulatory system. So it's kind of an extension, I guess you could say, of the circulatory system. So the circulatory system has its pump of the heart that helps pump the blood through our veins and, do that whole process. The lymphatic system kind of connects into it, but it doesn't have its own pump. So it relies on our muscles to help kind of contract against the vessels to help pump that fluid up. And then it relies on our respiratory, our breathing system to help kind of move it through the thoracic duct, which lies in our abdomen. And then it relies on the valves. You can kind of see how they have they open and close to help kind of prevent that fluid from the backflow so that it doesn't keep going down. So kind of how I was talking about, if your BMI is over 30, things get kind of stretched out and those valves can't close properly. And so that's why there starts to become a little bit of backflow, which then that fluid goes into like your interstitial fluid. And that's where some of that edema starts to happen. And then it also relies on like our smooth muscle contraction. So like in our abdomen, like our intestines, like the peristalsis to help move that through. And then from external compression is how our lymphatic system kind of circulates throughout our system. So kind of with how does this affect obesity or weight? It's kind of indirectly related. So it plays a major role in our health and inflammation and our immune function. So when our inflammation is high, obesity is kind of related to that chronic low-grade inflammation. So the adipose or the fat tissue produces inflammatory cells, and then the immune cells, they all kind of contribute to inflammation. And when things are inflamed, we all know that causes dysfunction. So then when it's not working properly, it can't efficiently remove the waste from our tissues, and then that's going to affect your metabolic health. And then we kind of talked about with the BMI already. So when the lymphatic system isn't working properly, it can, not always, but it can result in lymphedema, which is basically an accumulation of the lymphatic fluid that results in swelling. So there's different types of lymphedema, and it's characterized by stages as well. So there's stage 1, which is kind of the least intense, all the way to stage 4. So lymphedema can be both primary, which means that it's genetic. You're born with some sort of compromised lymphatic system, maybe like an area wasn't developed properly, or there's genetic diseases that cause lymphedema, or it can be secondary, which is often what we kind of think of as, like when people have breast cancer and they have the affected extremity. But then a lot of times that there's like venous insufficiency in different diagnoses, people get it in the lower extremities as well. Now, you can get lymphedema anywhere in your body. It can be truncal, it can be literally anywhere. So it's kind of some of the signs and symptoms of lymphedema they're going to typically be asymmetrical. You're going to maybe notice that one limb is more affected than another limb, but by all means, it can both limbs can be affected by it. People often will say that there's a feeling of heaviness or tightness. They may have limited range of motion. Like if you, in the upper extremities, they'll do like elbow tests where you bend your elbows, and you may notice like, oh, I can't get my one arm down quite as tight as the other side because of the tissue in there. So there's different tests that they'll look at that way. But you might also have some aching or discomfort. And then oftentimes, because of the skin integrity with the lymphedema, you're at a greater risk of having like cellulitis if you get a cut or something like that. So one of the gold standard for treatment is called complete decongestive therapy. So it involves using compression garments. So sometimes you'll see people with the ACE wraps on their legs. Some people use like a Velcro wrap to help get your limb reduced, or they may have like compression stockings or sleeves. And then another part of the decongestive therapy is manual lymphatic drainage massage. And I'm going to talk about that a little bit later. But then it's also really important to include exercise, make sure you're doing good skin care and hygiene, just because you're at a greater risk for skin breakdown. And then the lifestyle modification is really important as well. So that's where like our diet can really play a big role in helping the treatment of lymphedema. So lipedema, they sound very similar, but they're two totally different things. And a lot of it affects primarily women. Men can be a carrier of lipedema, but it typically is not going to affect them like it's going to affect women. And most people, it's a very underdiagnosed and underaddressed diagnosis, in my opinion. Because a lot of people aren't aware of this condition, but it's a chronic condition that has an accumulation of fat. It's going to happen in just the lower body, but it can happen in the arms. It can happen in the trunk as well. And you'll notice a lot of times that this change will happen during, I don't know what happened. Ah, sorry about this. I don't know.
We could see it, Sarah.
Oh, you can see it?
Yeah, we could see it. Now I can't though. It must have popped off now. Now I can see it now.
You can see everything normal?
Yes.
Okay.
It's like a reduced screen, like narrowed, but it's still fine.
Okay.
Like just a little bit smaller, but
Okay. Um, so sorry about that. A lot of times people will notice it during hormonal changes is when it kind of starts to affect people. So like during puberty or during pregnancy, they'll notice some of these changes. So some of the characteristics of lymphedema is the lower body is going to typically be larger than the upper body. Most of the time the feet are not affected. So you'll notice on, like, if you're looking at the legs, the fat tissue is kind of be disproportionate from the rest of their body. And then at the ankle, they kind of develop a cuff where, because the feet aren't affected, it's just kind of like the adipose tissues there, and then it just kind of stops. Most of the time it's going to be symmetrical, so affecting both sides of the body. It tends to be more, that tissue tends to be more painful. So sometimes it's misdiagnosed as fibromyalgia. It will bruise easily. There's a lot of fluid retention. The skin texture and the temperature and the appearance is different than typical fat as well. During testing, the stemmer sign, it's kind of, if you do a pinch, like on the top of your finger, the top of your toe, it will, a negative stemmer, the skin's going to just go right back down. A positive is where it stays elevated. So most of the time that test is going to be negative. And then there's typically not any kind of pitting edema associated with it. And then there is some similarities where there's some hypermobile joints as well in some people. And the treatment is very similar for lymphedema as it is for lymphedema, with using compression. You may use the pneumatic pumps as kind of an intervention as well. And then the manual lymphatic drainage massage, exercise, pain management, and then the lifestyle modification. And then some people, they end up going more of a surgical route to remove that type of fat tissue. Which they use a different type of liposuction. It's more water assisted, and it kind of helps spare the lymphatic system as they do it, so it doesn't cause injury to that. So manual lymphatic drainage, it's a very gentle massage. It's very superficial because the lymphatic system lies just beneath the skin. It's very rhythmical. And so most people find that it gives kind of that relaxation effect. It has that analgesic effect. But basically it's going to be used to help stimulate the lymphatic system and move that lymphatic fluid through the lymph vessels to help promote the drainage of that excess fluid. So it kind of helps bring it back into the system to move its way back out. And if you are going to get a manual lymphatic drainage massage, I recommend that you see somebody who is trained and certified in it, because they're going to be aware of the precautions. They're going to look at your medical history and make sure that there's no contraindications that you may have that would limit you from getting the manual lymphatic drainage massage. So you can even do some lymphatic massage yourself. So I like to start kind of right here at our clavicular area, and you just kind of move and bring that fluid in towards your neck. and it's just kind of a nice circular motion. So I always kind of start there. You can kind of work and rub it in from your shoulder, bringing it in. And you always want to think about moving like from going towards your body and bringing that fluid up towards like your trunk. So this is a really good way just to kind of get things moving, that you can do your own self-manual lymphatic drainage massage. And there's tons of videos online that you can go on and kind of have people walk you through, you know, going down the arms and your belly and those kind of things as well. And then diaphragmatic breathing is really important. A lot of times when I'm teaching it, I tell people to try it laying down because it's a lot easier to learn that way. And some people know what it is. A lot of times singers are really good at it. But if you watch a baby sleeping, you watch and their belly will rise and fall. And then usually around age 4 to 5, gravity stresses all of life kind of happens, and we start to become very shallow breathers, and we kind of just keep it more in the chest. So if you put a hand on your heart and a hand on your belly and you just breathe normally, you're most likely going to feel your chest rising and falling, and you're not engaging your diaphragm and having that belly rise and fall. So there's a thoracic duct which lies in our abdomen, and it's kind of the major lymphatic vessel in your body. So if just as a starting point, doing diaphragmatic breathing can help kind of boost your lymphatic system. It will also help with relaxation. It reduces pain, and it brings oxygen to the body that's needed for cellular metabolism and detoxification. So I kind of have a picture here where I like to tell people to breathe in through your nose and kind of visualize that breath going all the way down to your belly button, and have that your belly expand with it, and then exhale slowly. It's kind of that we always say, smell the roses, blow out the candles, but in through your nose and out through your mouth, and try to elongate your exhale. But you really want to have your belly rising and falling, and not just your chest rise and fall. And that will help stimulate and pump that lymphatic system. Some other exercises that are good for the lymphatic system: swimming is really good for your lymphatic system. Not only does it help promote mobility, it's easy on the joints, it's low impact, but the pressure from the water helps kind of give that natural compression that we've already talked about. That's really important for the lymphatic system to help kind of push that fluid out of your system. So swimming is a fantastic exercise for the lymphatic system. Doing yoga is wonderful. It's the muscle contraction. And a lot of times, you know, with yoga, we really focus on our breathing. So you tend to get more of that diaphragmatic breathing with the movement to really promote that movement in your system. Walking, chair exercises, neat movements are great. So those are just the extra movements that we add into our day. You know, it's parking farther away when you're going to the store, or it's taking the stairs instead of the elevator, just getting up, moving around in the house, marching in place while you're doing your brushing your teeth or cooking. Any of those kind of things are, you know, just to help move your body. Rebounders are basically like the trampolines, and they have some really nice ones that have handlebars on it so that it gives you some control if your balance is off. But jumping will just kind of help get that vibration and that movement. A lot of people like the vibrating plates to help with that, like especially if they're somewhat limited in their ability to move, just that vibration will help stimulate things. And then dry brushing is also another way that people can kind of do some home self-management as well. So with lymphedema and lipedema, unfortunately, there's no cure. It requires ongoing treatment and management. So a lot of times people will go through like the complete decongestive therapy. They'll get their compression, you know, they'll get set up on their home program. And then usually 6 months into a year, they'll come back for some maintenance just to keep things moving. it's important to manage the symptoms that are associated with it because it is progressive. So if you can stay on top of it, it's a lot easier to manage long term. And then using like a healthy lifestyle. So, you know, like you're in anti-inflammatory diets. There's a lot of research that shows like the low carb, high protein diet is very helpful for the lymphatic system. And then just that early detection and intervention is just so important. And then, you know, like always, if you're starting new exercise or a new diet, you always want to talk to your physician or your healthcare team. And then kind of, I think a lot of times what I've noticed when working with people, people have gone through all kinds of specialists and different doctors, and you know, it's never, they might not get the answers, or you know, it's like, oh, it's this or it's that. So sometimes you know, just knowing who to talk to is really important. So, you know, if you have any concerns about anything, you know, always talking to your primary care physician. You can talk to a certified lymphedema therapist. A lot of people, like, especially if there's vascular issues, like or like chronic venous insufficiency, talking to a vascular specialist, an endocrinologist, dermatologist, oncologist, dietitians, plastic surgeons, and they might be able to help route you to where you may need to go and what you need to do. And then to find somebody who's certified in your area, you can always use Google, do a search for, you know, therapists that are in your area. LANA, the LANA, it's basically an extra credentialing for a lymphedema therapist. So they have their list of practitioners who are LANA certified. You can go to lymphedema, like schools that do the lymphedema training, such as Close, Norton, Eccles, and they'll have like a practitioner search for you to use as well, to see if there's anybody that's local to you. And then sometimes it's just asking people in your healthcare network that if they know of anybody as well. Does anybody have any questions?
Let's see here if there is any. We'll give them a second. Sarah, I have a question.
Yeah.
I noticed, you know, whenever we get sick, or we have something going on, sometimes we get swollen lymph glands and that type of thing. Right now, I've been noticing on the side of my neck, it's on the right side here, I have a swollen lymph gland and it's really sore. I was kind of trying to do some like little lymphatic massage last night to see if that would help. Do you have any recommendations on any of that? And why does that happen, like whenever we get sick or when something happens?
Yeah, so the lymph nodes, you know, that's kind of a major part of our immune system. So everything's kind of going into that fight mode. And so a lot of times when we get sick, we will notice that our lymph nodes, like our tonsils, they do get swollen and irritated because there's a lot of filtration and stuff that's happening in those lymph nodes, and they get kind of bogged down. So yeah, definitely like kind of massaging it, stimulating it to help kind of clear that fluid out of there is really good. And, you know, with the manual lymphatic drainage massage, it does, you don't have to have lymphedema or lipedema to benefit from it. Anybody can benefit from it. You know, there's a lot of people that will start getting it when cold and flu season starts, just to get everything really activated so that you don't get sick. Kind of as a preventative measure, and just to kind of keep everything really moving. So manual lymphatic drainage massage, it's a wonderful massage. It feels amazing, and anybody can get it.
How does it differ from regular massage, would you say?
So a lot of times, so with manual lymphatic drainage massage, it's definitely much more superficial. You know, deep tissue massage, trigger point massage, sometimes it's just too much for people. And so, you know, that's really getting in and working the muscles and the muscle fibers, where the lymphatic massage is going to help just kind of promote that movement and really get your system kind of that blood flowing, the lymph flowing. It's definitely more, it's slower and a lot more superficial. So a lot of times people, like they come in and they think that they're going to get that deep work, and it's totally opposite of that. But it's still affecting the whole entire body when you get the lymphatic drainage massage, even though it's not that deep pressure.
Right. There's two other questions here. It looks like on Facebook we have someone who, Stacy says, you said it was a lifetime condition. So does getting your BMI under 30 help?
So anytime that we get our weight reduced, it definitely does help. Sometimes what happens too is, if you're undergoing bariatric surgery, especially with like the lymphedema, you may not, because it's a different type of fat. So sometimes that you don't get that result that you're exactly looking for, but the treatment will definitely help with it. And then, if you do have the weight reduction, it is easier for your body to manage the lymphatic system because it doesn't have to work quite as hard, just like all of your other organs aren't working as hard as well. So it definitely does help.
There's another question here. This person says, I have lymphedema in my legs. They hurt all the time. I have been doing lymphatic massage for a few months by it looks like an abbreviation, but do not notice a difference in the pain level. What should be my next step? I have lost 130 pounds in 7 months, but this is not changing.
Congratulations, first of all, on the weight loss. That's totally awesome. I would say, I don't know if you're seeing, I would see a certified lymphedema therapist. I don't know if you're doing any kind of compression, but that can help with it. And then, just the diet change, make sure that you're exercising. And then the lymphatic massage will also help with pain management as well.
Sarah, can you tell me too, do you think that it is possible that you mentioned diet? Do you think taking in extra fluids? Do you think any supplements? Is there anything else like that a person can do?
So it kind of depends on if there's other medical things going on as well, but getting enough water definitely helps kind of flush things out. Kind of like when you're sick, they always say, make sure you're getting your water, drink your fluids to flush your system. So that definitely does help. But if you have some other medical conditions, you do need to kind of be careful with that. And then there are different supplements out there that do support the lymphatic system. But those would be something that you would also want to talk to your doctor about before taking any kind of extra supplements, just if you're taking different medications or anything, just to make sure that they're not going to interfere with that as well. But there are different ones that, they're not super supported because it's not FDA approved. But there are different things that they do recommend with lymphatic conditions.
That's great to know. I also have Kathy here that's asking, she has a question that she wanted to ask verbally. So I'm gonna put her to I'm gonna adjust her to a panelist, invite her. Give me 1 second here. I think I have to do it a different way. Okay, Kathy, oops, I accidentally did a different person. Disregard if you're that other, disregard. And let me do Kathy.
Brenda, I did get an unmute. Can you hear me?
Yes, I can. Kathy, did you want to be on screen too, or just?
I don't have to be unless you want me there.
I'll promote you to panelist. I got you now. Okay.
Thank you. guess can you hear me now?
I can, yeah. It's not showing you, but that's okay. You can talk if you'd like.
Okay, I'm there
Oh,
now.
there we go. We have you on screen too.
Thank you. Thank you, Sarah, for being here today. This is a topic that is of great interest to me. I developed lymphedema post mastectomy surgery and have been managing it fairly well. And then I had bariatric surgery. So my question is, with the BMI, how drastic would that affect the lymphedema post-operatively for mastectomy, or would it not really address that issue at all?
So are you asking if, like, because you already had it, if having surgery is would affect your lymphedema, like give an exacerbation of it?
Or affect it positively? Is there any effect one way or the other?
Yeah. So, I mean,
Having lost the weight and changed the BMI.
yeah. So if you lose weight, like, and well, I guess I should back up with a surgery, we never know what can happen. But it's kind of your bariatric surgery was kind of in a different spot. I wouldn't think that it would affect your arm too much. Depending on how many lymph nodes and those kind of things that they take out, obviously you don't ever remake a lymph node kind of thing. So, potentially, I never say never kind of thing, like potentially that could happen. I wouldn't think that it would. People have surgery all the time with having lymphedema, and so, can it affect it? Sure. But I think if you're managing it, that's the most important thing. And then with lowering your BMI, things can move more efficiently. And then when you're getting those muscle contractions, it does make it easier for your lymphatic system to pump that fluid throughout your body. And then in addition, just if you're with your gut health, a lot of times once we've had bariatric surgery, we've made that diet change, that we're eating more whole foods, more protein, and then that helps with our digestion as well, which is really good for the lymphatic part of our intestines.
Thank you. The reason I wanted to ask that question is that I, with the weight loss, obviously had to redo the compression sleeves and all of that, just because of the size of my arm, because of the weight loss.
Right.
But I was not, after listening to your presentation today, I wanted to comment that I have not really noticed much change with my lymphedema situation after losing all of the weight post-bariatric surgery. And so I wasn't seeing much of a correlation there at all, with potentially an improved lymphatic system with a lower BMI. So that's why I just wanted to, and they did severely disrupt that lymph system with removing 21 nodes. So that was just kind of crazy, but I wanted to just verify that with you. So thank you.
Yeah. And so even too, the tissue is different. It's not like it's fat in your arm, so it's a whole different beast that you're going against. So, a lot of times, like even with that weight loss, you might not see the changes that you may anticipate there, just because it's just totally different.
Great. Thank you so much.
You're welcome.
Kathy, thank you. Okay. There's another question here. Rhonda says, I recently had gastric bypass, ended up with a blood clot in each leg, treated and now they're gone, but have lymphedema in my left lower leg and ankle. Fixing to receive the medical equipment that will help further reduce it. Would it be helpful to go to a lymphedema masseuse?
Yeah, I think that it could be beneficial. You would, depending on how long ago the DVT was, kind of affects the treatment plan as well. So, I would definitely make sure that you're seeing somebody who is certified in it so that they know how to treat it properly. But, you know, the lymphedema part of it absolutely would be beneficial for you to see somebody.
Sarah, can you tell us like what would be like if what would be some of the things that somebody who is a specialist might watch for rather than just a regular massage therapist or someone who's not really trained in that?
Yeah. So, you know, the lymphedema certification, it's pretty intensive. We have several hours under our belt of just training on the lymphatic system and the treatment of it. So we're going to look at you more holistically and medically, you know, looking into your past medical history. Have you had DVTs? Do you have any kind of issues with congestive heart failure? Have you had any kind of aortic abdominal aneurysms? Like there's certain conditions that we look for that might make us do our treatment a little bit differently, or we might say, oh no, that's totally not right for us to do right now, or let's wait a couple of weeks until we can start this treatment. So we're going to look more at you from a medical perspective to make sure that our treatment is the best treatment for you. In addition to, we would do the whole complete decongestive therapy. So if you just go to, I mean, there's some people out there that they say that, oh yeah, I do manual lymphatic drainage massage, but they're not certified in it. So they're not allowed to do any of the compression, talk about the compression, like talk about the whole system of it for the gold standard of care. So there's just a lot more education and knowledge to support what we're doing, how we're doing it, why we're doing it.
And Sarah, actually, Kathy, what that was just on here, she's a dear friend. She's a coach as well. And she said, I might add for anyone who has never had this treatment, it is rather intimate. So make sure you feel comfortable with the therapist in the treatment situation. And I think that's pretty key, you know, because you are exposing yourself,
Yeah.
it's
And you know, I think that's really important with any kind of treatment, is to make sure that you feel safe and comfortable. But it is like, you know, typically it's a skin to skin treatment. You know, like if you think about where your primary lymph nodes are, is your armpits and your groin. So it is close to that area. So I definitely agree that, you know, you want to make sure that you feel safe and comfortable with your provider. That's great. A great.
yeah. And Jeremiah came in a little bit late, he says, but he is asking a question about, can gastric bypass and losing the weight get rid of lymphedema, or will I always have it? So we kind of talked about that. Um, One thing I will say is Sarah did mention it kind of depends on the reason that caused the lymphedema, possibly, surgery versus anatomical. But Sarah, I'll let you finish answering that question.
Yeah. So lymphedema, unfortunately, it's not quote unquote curable. But it is, you can manage it so that it doesn't get worse. So, you know, if you have lymphedema, you're always going to have it. But it's just really important that you stay on top of your exercises, stay on top of your compression, and kind of do that long-term maintenance care for it.
Great. Well, Sarah, how about you tell us a little bit about maybe if there's somebody who wants to reach out and learn more about you, about what you do. Do you feel comfortable doing that? Do you want me to share my screen and
Sure.
share your website? I can do
Yeah.
that if you like.
That'd be great. Yeah. So if you have questions or, you know, kind of, is this appropriate for me? I do like holistic weight loss coaching. I do it if you're local to Arizona. I live in the East Valley of Phoenix. So I would love to see you, meet you. So I do it both in person, and then I also do virtual coaching as well. And you can if you're like on the fence of like, is this appropriate for me? Is this good for me? You can always schedule a free 15-minute phone consultation. You can go to my website, which is supportingbariatrics.com, and schedule the consultation. I also have some packages for both in-person and virtual coaching, that if you mention that you saw me on this podcast, I'll give you an extra 10% off. If you go to my website, you can go to the plans and pricing, and then that will work you. You can see the different packages, or you can do basically like an a la carte, that, you know, you can kind of pick and choose what you may need, as well. And then we kind of talked about, Brenda, I also will give the 10% off. I love the supplements that you guys use, so it's one of the things that I encourage my patients to use as well. So there's the 10% off for the supplements as well, and there's a link on my website to get to that, to order your supplements.
I'm gonna actually, I'll put in your website, Sarah, and I'll put in your link here in both Facebook and Zoom. If you're listening to the replay, you can find that in the description. Let's go to your ProCare link. So Sarah is an affiliate with ProCare. And Sarah, tell us about what you've tried before as far as products.
So in perfect timing of Valentine's Day, I absolutely love the dark chocolate calcium. I think they are delicious. So I really like the chocolate calcium. I love the calcium chews. I think there hasn't been any of those that I did not like. I like the cinnamon roll. I like the mocktails. I like them all. I also have used the bariatric multivitamins, and I've been really using a lot of the one that has the probiotic in it. I feel like that just really helps with my digestion. And then I really like the powder calcium. I just throw that into my drink in the morning, and I don't even really realize that I'm taking a calcium with it, but I really like that product as well. So those are kind of my big ones that I've been using. And I like the fish oil, the Megaplex one.
Sarah, I am looking for, so I posted your link on our Facebook and our Zoom call here, but I'm looking on your website. Where did they find that on your website?
It should be, there's a place that I think it says supplements, or Sarah recommends under that.
Okay, I will show them where to go from there. Pop on our Zoom one more time and start sharing one more time here. And guys, this is kind of cool. Since it's Valentine's Day, we are offering another special promotion. So if you use Sarah's link, so go up here, it's supportingbariatrics.com. Again, supportingbariatrics.com under Sarah Recommends. And so Sarah's links, if you use her link here, you can do shop now, and that'll get you directly to the ProCare website. When you go to ProCare, we have a special promotion today. It ends tomorrow. It ends on 2/16 if you're listening to the replay. 2/16 of 24. Be Our Valentine, free chocolate with a purchase of $50. So you could use Sarah's code. When you check out, you just put in her code, which is Supporting Bariatrics, and that'll give you 10% off. And then you can also get a free bag of chocolate if you purchase $50 worth or more. So that's kind of fun.
They're so good. I love them.
We just added that promotion. It was like a last minute thing. We thought we wanted to do something special, and I'm glad it kind of worked out with this event because it kind of goes hand in hand. So the chocolates that we're talking about are calcium 500 milligrams with 500 IU of vitamin D, and they're really, really good. They're actually seasonal, so we only have them as in the cooler months. And looks like Kathy's commenting the dark chocolate calcium is the best. Thanks, Kathy, for joining us. And Denise says, I'm on auto ship, not fair. Denise, call our office and see if they can help you with that. There is a support number. I'm going to go to our website real quick. Is that okay with you, Sarah, if I show them that
Sure.
on our website? Okay, so on the website, up at the very top of procarenow.com, there's a call us 877-822-5808 and see if they can help you if you can take advantage of any of that. I'm not really sure how that works because I know that our products are quite discounted on the auto ship, so I'm not sure, but definitely can check that out if that's helpful. Also want to just mention, so anybody that's new to joining us, if any of these events, like Sarah's event today, there is a tab called Very Connected at the top of the ProCare Health website. And when you click on Very Connected, it will get you our events for the full month. So this month here, if you kind of scroll down just a little bit, it takes it just a second. For some reason, I'm not sure how this is set up, but it takes it a second to pop up sometimes right here under weekly events. Sarah's event will be popping up there. Let me refresh it, see if that helps. Yeah. So you can listen to the replay by, well, it did for a second until I refreshed it again. You can pop on and you can register. If you're already registered, the on-demand replay will be available till the end of this month. We also put all of our replays on our YouTube channel, which I'll show you here in a moment. And we also have not only our weekly live events, but we also have a monthly support group that's going to air this Thursday, this Thursday, February 15th, 5 p.m. Central Standard Time. We're doing easy meal prep. And so you can still register for that. That's fun. That'll be on replay if you're not able to make the live event. And then everything is added again to our YouTube channel, which is a little icon you can click onto, or our podcast channel, which is called Very Connected. All of our events are always added about a week later. So Sarah's event will be added to the podcast and the YouTube channel by next week on Tuesday. I'll show you real quickly what that looks like. We have over 200 events on there. I hope I'm on the ProCare channel. Yep. It's taking me a second. Sorry, guys. Here it is. It's going to automatically start playing one of our episodes. Yeah, we have over 212 videos on there. Subscribe if you're not already a member, and you'll get notifications when those are added, so you can listen right away to anything that of your heart's desire. We have lots of different things there. And also I want to say we also just started a Facebook page, which I will show you. It's called Very Connect and Very Connected. I'm going to go to our Facebook group. So you can join the Facebook page, become a friend, and then you can join our Facebook group called Very Connected. We love to have you. So we can talk about different things within that forum. I don't want to go too far down because we do have new members that's joined, and I just don't want to share private information. But join us in that group and become a member. We just hit 1,000 members, so I'm excited. Stop sharing there, and there we go. Lots of information there, guys. Sarah, I do want to say one thing about your website that we were talking about, the website again for Sarah's supportingbariatrics.com. Tell us about your packages that you have. I might pull those up one more time because we kind of skimmed over that because I was talking at the same time that I was moving the lens around. Here we go.
So basically I offer kind of a 4-week plan, an 8-week, and a 12-week plan. The big difference between the virtual versus the in-person is if you're in person, it also includes the manual lymphatic drainage massage. But if you're doing the virtual, it's something I can teach you how to do. I'll be teaching you how to do the self manual lymphatic drainage massage. I do initial evaluation, lots of getting your medical history, making, and kind of identifying the areas that you need help with for those lifestyle changes. So I focus on doing coaching, developing exercise programs for you. Sometimes it's just hard to know, where do you start, and what's right for me to do, how do I do this? So kind of working on doing some yoga for that mindfulness, that mind-body connection. You know, we may talk about how to start doing cardiovascular exercise, strength training, those kind of things. In addition to the coaching just on just lifestyle changes in general, talking about your diet, your nutrition, you know, talking about behavior modification, how to have a successful long-term weight loss journey. Because, you know, the surgery fixes the stomach, but it doesn't fix the head. And so, you know, there's a lot of stuff that goes into it. So kind of coaching you through those kind of things. And then you also get the discount for the supplements as well.
So Sarah, like, tell us again, you know, your background and training. You are, so I imagine you pull a lot of these things together. Your occupational therapy background, your personal trainer background, your health coach training, your nutritionist, certified nutritionist training, and then the massage piece. And I know the yoga, I don't know if you pull, I'm sure you pull just a little bit of everything,
Yep.
correct?
Yeah, that's where, you know, like my background, it's very eclectic. But I pull from everything. Just because I think each component of is so important for that holistic lifestyle change. So I definitely, you know, there's a lot of overlap in different areas of my background, but I definitely do try to pull from each area that I've studied just to help make those changes.
And Sarah, just to kind of reemphasize here too, you mentioned that you are willing to do a 10% discount to those people who are coming into one of your programs. Is that correct?
Yes.
For
Yeah.
being on this call?
If you mentioned that you saw me on the podcast, I'll give a 10% discount off my packages.
Awesome. So how did they go about doing that if they were wanting to register by chance?
So you can go on to my website and then you can choose the package that you would like to purchase. And then it'll link you to get scheduled for your initial evaluation. Or if you have questions before you want to make that purchase, you can always do the free 15-minute phone consult. We can talk about things and then get you scheduled that way. But through the
Awesome.
website, you can schedule.
Okay. So they will have it. They will be able to put a comment in there that they were a listener of the podcast. Okay. Yeah. Okay. Perfect. Perfect. Wonderful. Well, any last closing thoughts? Any last closing thoughts? Did I cut out?
Nope. I think I appreciate you having me on the podcast. I'm so grateful to be here. And I hope that everybody learned a little bit of something and everybody has a very happy Valentine's Day.
Oh, thank you, Sarah, so much. And Victoria says thank you. And Stacy says thank you. We appreciate you so much. And I will be in touch. I'll be sending you an email too as well. Linda says thank you. So we appreciate you. This was great. I feel like I learned quite a bit. I didn't realize that there was such a difference between the lymphedema and the lipedema. We've actually had one of our guests in the past talk about lipedema. Her name was Beth and kind of went into detail on this. So this was new and refreshing, very different. So thank you.
You're welcome. Thank you.
Okay, everybody have a happy Valentine's Day. Enjoy the rest of your day and take care until we see you hopefully tomorrow on our support group, which is on meal prep. Thanks, Sarah. Take care.